Hello guys, welcome back to Being Medic, your trusted source for medical information. Today we are diving into an important topic that affects millions of people worldwide, diabetes. We will break it down into simple terms covering the causes, symptoms and management. So let's get started. First, let's understand what diabetes is. Diabetes is a chronic medical condition that affects how your body processes glucose, which is the sugar in your blood. Glucose is essential for energy, but in diabetes, it can't enter your cells effectively, leading to high blood sugar levels. There are two types of diabetes, type 1 and type 2. Type 1 diabetes is usually diagnosed in childhood and adolescence. It occurs when your immune system mistakenly attacks and destroys the insulin producing cells in your pancreas. Insulin is a hormone that helps glucose enter cells. And type 2 diabetes, which is more common and often develops in adults. In type 2 diabetes, your body becomes resistant to insulin's effects and your pancreas can't produce enough insulin to overcome the resistance. So, how do you know if you might have diabetes? Look out for these common symptoms: frequent urination, excessive thirst, unexplained weight loss, fatigue, blurred vision, slow healing wounds. If you experience these, it's essential to see a doctor for proper diagnosis. Now let's discuss the causes and risk factors. While the exact causes vary between type 1 and type 2 diabetes, genetics and unhealthy diet, lack of physical activity, and obesity can increase your risk of developing diabetes. Managing diabetes is crucial for a healthy life. Here are some key steps: monitoring blood sugar levels regularly, following a balanced diet with proportional control, engage in regular physical activity, taking prescribed medicines, reducing stress, staying informed, and working closely with your healthcare team. And now there's a blood sugar chart. So, according to this chart, we have the values of normal, impaired glucose, and diabetic patient glucose level in fasting, after eating, and 2 to 3 hours after eating. As we can see here, 80 to 100 in fasting is normal. After eating, 170 to 200 is normal, and 2 to 3 hours after eating, 120 140 is normal. But in case if we have 101 to 125 in fasting, it is impaired glucose, and after eating, if it's 190 to 230, it's impaired, and 140 to 160 after 2 to 3 hours of eating, it's impaired. And in diabetic patient, in fasting is 126 plus, after eating, if it's 220 to 300, it's diabetic, and after 2 to 3 hours of eating, 200 plus, it's also diabetic. To wrap it up, diabetes is a serious condition, but with proper management you can lead a fully healthy life. Thank you for joining us on this journey of understanding diabetes. If you found this video helpful, please like, share and subscribe to Being Medic for more informative content.